suppression strategy assumes that the virus can't be eradicated, that it's basically let it in, let it run, and try to contain it by putting out spot fires, or if it surfaces in a hotel or an aged care facility, to just try to keep it contained. At the beginning of all of this, that was an approach adopted in some countries in the world, Sweden, the United Kingdom, United States, and has been, to one degree or another, a mess. It doesn't work really. It doesn't correspond with how the virus gets around and how infectious it is. So we had a choice in mid-March in Australia and New Zealand between so-called suppression, that is just trying to do the best we can but don't go for eradication, and eradication. So that was in March. Here we are in July. In Australia and New Zealand, we have about 30 million people. Today, about half that number of people, about 14 million, are living in jurisdictions that have eradicated the virus by never letting it in and making sure that they got rid of it. And another half in New South Wales and Victoria predominantly are living with the fruits of the suppression strategy, and it really hasn't worked very well. Well, it would mean having a lockdown of the sort that we have already endured in March, April, May, and that is underway in Victoria now. So let's say in Victoria, people are there for 6 weeks, and they will presumably, if the numbers can be reduced, come out of that sometime in end of August. And I think it would be far better for Victorians, for their health, for their jobs, for the economy, society, if they came out of that and they were free of COVID, as they are in South Australia and Tasmania and New Zealand. It would mean doing it properly this time, but doing it one last time. I don't think we can just have this cycle of rinse and repeat of Groundhog Day, hoping for the best. I think it's pretty apparent in Victoria and New South Wales there are, regrettably, some real deficiencies in the capacity of the health systems to manage so-called suppression. We seem to find out after the event, as we have in Kazula, infections. We don't do all the things we should do to minimise and stop those infections. There was an opportunity a couple of weeks ago, clearly, in the New South Wales-Victorian border to stop the infections coming back into New South Wales. So it's a very patchy result. And I don't think it does much for the confidence of the Australian people who've got to live through this. It's not good for their public health. It's not good for jobs, not good for certainty. And of course, where you do have the cases at the level we have in Victoria now, 230, 240 a day, maybe going up, we put our frontline staff, the doctors and nurses in the hospitals, at an increased risk of infection. The evidence from overseas is very clear that apart from the people who have the infection in a hospital, the people in our community who are most at risk, therefore, from those infections are the people in the hospitals who have to treat them. So that's something really we should avoid. I do, yes. And that's the opinion of people who live in Western Australia, Northern Territory, Queensland, South Australia, Tasmania. I think just ring your friends and family there. Ring them in Perth and say, would you rather be in Perth tonight or in Melbourne? A couple of nights ago in Perth, they had 10, 20,000 people at an AFL match free of COVID. That can't take place in Melbourne or with the NRL in Sydney. The science and the evidence is in. We have to have the strategic goal of eradication. It can be done. When we talk about eradication, we're talking about it working in our part of the world, not in a country far, far away. We're talking about it having worked between March and June in the outlying states of Australia and in New Zealand, where they haven't had a case of community coronavirus transmission for well over 70 days. So it can work, it should work. I think the leaders of Australia and New South Wales, Victoria, have to steel themselves. They have to bring the community along with them. Proper communications this time, better contact tracing, being really serious about it and saying we can stamp it out. That's what the science and the evidence shows. And if they don't want to do that, then I think they have an obligation to come back to the people and say, well, we're not going to stamp it out. We've decided to live with this many infections in the community, this many hospitalisations, this many deaths. All of those figures have been done and supplied to the leaders. So let's level with the Australian people and see what the consequences of that are. But I don't think the Australian people want to go through this endless cycle of lockdown, open up, lockdown, open up. It's confusing. It really only helps the virus do its work. And I think we should put the virus out of business, really. Well, you'd have to ask them. I think that people get very bound up. The advisors to the leaders decided way back in February, March, they would have this strategy of basically accepting the inevitable, coping with it. They thought that was the best strategy. I think they were wrong, but they got bound up in doing it. And at that time, I can remember many people outside those advisors, myself and others, said we should go the New Zealand way. We should lock down, do it properly and once and get rid of it. And the leaders at that time, New South Wales, Victoria and federally, said no. Funnily enough, the leaders in Western Australia, the Northern Territory, Queensland, South Australia and Tasmania took one look at what was happening and said, we're shutting the borders. We're not going to let it in. And if it gets in, we'll stamp it out. Now, I don't think at that time they were saying we're going to eradicate it, but in effect, that's what happened. So it could be done, and you'd have to ask the leaders concerned why they have been so reluctant to embrace it. Maybe in March there was a difference of opinion before we knew what would have happened, but that was March and here we are in July. We can see what's worked well. We can see maybe 14 million people in Australia and New Zealand now living COVID-free, and we can see those in New South Wales and Victoria struggling badly. And let's remember, every 270 cases a day in Victoria, that's 270 people who are really sick. And the long-term consequences of being ill with COVID are not known, but they're not good. It's not influenza. And then a proportion of those go to hospital, terrible things on ventilators and so on. And very regrettably, a portion of those people will die. So I can't see that's a good strategic objective of our political leaders. I believe in people being happy and healthy. I don't believe in putting them through avoidable suffering and pain, not to mention death. I think that's a bad objective. I'd rather a good one, and we can do it. And then, of course, as people say, well, will you keep the borders shut forever and what will go on? When will we get a vaccine? Well, we've just got to see. We've got to put all the resources we can into the vaccine, treatment, all of those things, better communication with people to bring them along, to make sure that we don't see repetition of silly things like we've seen in Sydney and Melbourne in the last few days, with people obviously not believing that this thing was going to affect them and wasn't serious. So we've got to do all of those things. We've got to keep at it. But as we've seen in the jurisdictions around us that have worked, it can be done. Well, surely that's a much better strategic objective, so that by September the 1st, by the beginning of spring, we can declare Australia, New Zealand free of COVID. And then we'll see what happens in the months after that. And of course, hope for the best. From the statements of the Prime Minister and the Premiers of New South Wales, uh, an endless cycle of virus going down, then surging back, as we've seen at Kazula, as we've seen in aged care facilities, uh, occurring because something goes wrong in infection control or people don't do the right thing or whatever, but this thing coming back. And then the authorities get there, they go and test, they contact trace. If it gets bad, they have to lock down. So we look at this endless, like guerrilla war with the virus. Now, this virus is not a supernatural zombie. Let's not overrate what it is. It's just a virus. And we learnt in the lockdown period that we all went through how pretty easy it was to make the job of the virus very hard. Social distancing and masks increasingly. We know what to do to knock it out. And that's what we should do. Otherwise, we just get this very despairing idea that, well, there's nothing much we can do and we've got to learn to live with it. Well, no, we don't. We don't have to learn to live with it at all, because we know what we can do to knock it out. So I think let's look at all the science and the evidence. Let's take better advice than we've been having that back this suppression strategy. And I think the Australian people should, really take it on themselves now to ask some very serious questions. If we just keep on doing this, how many people will be infected? How many people will go to hospital? And how many people do you expect to die? And for how long? They're good, serious questions. I think we should say that that's not the future we want. We want confidence, good public health outcomes, and very particularly, we've got to get confidence back into jobs and growth and the economy. I don't think there'll be businesses in Melbourne that are under this lockdown, the second one, who I don't think will survive the winter. And if they don't survive the winter, the jobs don't survive the winter. So we're in a worse position. How much better it would be if we could come out of it and say, gone, finished, stamped out. One of the problems that was puzzled me in relation to the suppression strategy was how adamant the advisors were that masks were not very useful. And this went on for weeks and months, March, April, May, June. Now, it is abundantly clear from the science and the evidence that masks can really, really effectively reduce the transmission of the virus in public spaces. Now, last week, to his credit, the Premier of Victoria, Chief Medical Officer, said it's very important to use masks. And I think in Melbourne, anecdotally, well over half the population when they're out and about are using masks. But they need to be adopted and recommended all over, in New South Wales, not all over Australia. You don't need masks in Perth or Darwin. But where we've got a problem, masks really help. And I think we have to ask, why did this take so long? It's something that really works. It's really simple. And it's this, I don't know, is it dithering? Is it over-analysis? Let's take some serious decisions that we know work and knock the virus out. That'd be the best thing to do, knock the virus out of business before the virus knocks our businesses and our people out.